So I wanted to finish off with a case study of a gentleman who I saw in outpatients 2 years after his stroke. He had good shoulder movement and strength, however he could not open his fingers and he really wanted to work on the grasp and release of his hand. He had been using eStim for the past 2 years, trying to improve this component with no change. So this is what his hand looked like. So you can see he's trying to open his hand, but he has no movement in his fingers or thumb. In a minute you'll see he eventually gives up trying to open and he just uses his other hand to shove the ball into his hand. At this stage he has a box and block score of 0 and MMT for finger extensors of 0.
Just stuck now.
So he purchased the SaeboFlex and completed 300 to 400 repetitions twice daily for 4 months. And this is what he then looked like. So you can see the active movement in his fingers and thumb. Not enough so that he's able to pick up the ball, but at this stage I changed his exercise program to 20 minutes with the SaeboFlex on and 30 minutes without. After another month, this was his progress. And you can see he has improved his fingers extension and thumb movements even more. Though he had improved his gross grasp, his pincer grasp was still very difficult when he was seated. And you can see in this video he has a lot of problems opening his fingers and thumb when his arm isn't hanging beside his body and standing. At this stage his spasticity was significantly less in his hand and he purchased the Saebo glove, which allowed him to complete mass repetitions of pincer grasp and release. Unfortunately I did not take any videos during this time, but he made improvements which allowed him to meet the criteria for constraint-induced movement therapy. And at the beginning of CIMT, his box and block score was 7. So remember, and initially it was 0. So to give you an idea of the time frame, this gentleman participated in CIMT 9 months after his SaeboFlex purchase. At the end of the 2 weeks of CIMT, this was the changes in his hand. So you can see the significant improvements in his pincer grasp, as he is actually able to move his thumb and fingers with his arm resting on the table. And one of his goals was to be able to use both his hands to pull up and down his trousers, which is what our next video is. So at the end of the 2 weeks, this goal was achieved. In the video, I want you to be watching his left hand because that's his affected side. So I've been telling him to put his hand back in, and you can see he does passively position it a little bit, but then as he's pulling them back down, keep watching that left hand, and you can see how much active movement he has of his thumb and finger as he uses his pincer grasp to quite easily and efficiently adjust and pull his clothing. So at the end of the CIMT, his box and block score was 14. And it was, remember, 7 before CIMT and 0 before the Saebo. And his finger extension with his MMT was about a 2. So now he is able to use his left arm throughout the day for reach and grasp. And remember that this man had no active finger movement 9 months ago, 2 years after his stroke. So through the repetitions facilitated by the SaeboFlex, this man was able to achieve his goals.